Hi, I'm Dr. Erin Ducat with Ducat Chiropractic and Sports Medicine here in Bloomingdale, Illinois. This video is going to be about neck pain, why it happens, and why you might be experiencing it. Neck pain is second only to low back pain and the most common conditions presenting in a chiropractic office. In fact, over the years, females have traditionally been having higher incidence of neck pain, higher risk for it, but with the changes in technology, so more cell phone use, tablet use, computer use, men are experiencing neck pain at higher and higher rates. So there's a couple of different structures that can cause pain in the neck. First of all, you do have the muscles here of the neck. So when you're holding sustained postures that aren't the best for a long period of time, the muscles themselves can actually produce neck pain. Generally, this type of pain will go away as soon as you change position. So you've been sitting on the couch for a really long time with your head forward and it's starting to get sore and you get up and it goes immediately away. Most likely that's muscular neck pain you're experiencing. You can also have pain in your neck that's coming from the joints themselves. A lot of times you're going to experience this type of pain if you extend your neck or perhaps rotate in that position. The joint surfaces become closer together and you can experience pain there. Also, over the years, if you've maybe had not the best posture, maybe haven't put the best type of load on your neck over a long period of time, you can have arthritis that sets up shop along the neck joints, causing you pain. The third type of neck pain is actually discogenic. In other words, it's coming from the discs in your neck. And this is an extremely common type of neck pain. I actually have a little model here. So I want to give you a little anatomy lesson and show you where some of these different structures are. So as you can see, the joints of the neck are these little lines right there, trying to get this in focus for you. And those joints have to move smoothly back and forth in order for you not to have pain. So if there's arthritic buildup in there, or perhaps you have one side that's just not moving as well as the other because you've been staying in one position for too long, you might need a chiropractic adjustment to kind of get that joint moving again, and then your pain improves greatly. As we said, there's also the disc, which you can see right here. So it's kind of like the soft, squishy stuff that's in between the bones. You can also see the disc a little bit right there. See that little red strip? And then this hole right here behind the bone and behind the disc is actually the spinal canal. So all of the nerves from your brain stem going down into the rest of your spine travel through this hole right here. And this little hole here on the sides is where the cervical or the neck spinal nerves actually come out and then go to innervate your arm. So a lot of times when people have neck pain, they may also have shoulder or arm pain as well. That's because these nerves here on the side, whoops, you guys can't see it, there we go, on the side are affected. Now, when you have your head in a forward head position, so something that looks like this from the front, or this from the back, which if you look around at your friends and family, this is like, I don't know, 80–90% of you guys. Additional pressure is put on the front part of your spine. So compression of the front. When your head shifts forward, it compresses the front. So I'm just gonna show you what happens here at the disc when we compress the front. So take a look at that disc, that little red area. As you can see, as I increase the compression in the front of this model, the disc actually bulges back posteriorly. Now, when it bulges back posteriorly like that, it can generate pain. Remember I said discogenic neck pain is one of the most common causes of neck pain out there. This is why. So when that bulging happens, it can generate pain. Now the bulge happens far enough, okay, remember what was in that tunnel? All the nerves for your spine. So you can have problems in your neck, in your legs. It can change your reflexes. Lots of things can happen when that disc actually protrudes far enough and starts hitting into the spinal cord. We call that myelopathy. Now, that disc bulge can also put pressure over here to the side based on its location on those spinal nerves that are exiting from the neck that supply the arm. So that's where you might get one of those pinched nerve sensations where you're having neck pain and then also arm pain. So as a recap, neck pain is super common, very, very common in women, becoming more common in men now that we're using technology more often. And neck pain could be coming from your muscles, from your joints, or from your discs. Now the good news is that chiropractors are very well equipped to treat neck pain from a conservative standpoint. So if you're having symptoms in either your neck or the arm, please give me or your local sports chiropractor a call or visit our website at ducatchiropractic.com, and we'll be happy to help you get rid of your neck and arm pain.